Welcome to Back in Motion Chiropractic's patient orientation class. I'm glad that you have joined us online for this class. This is different from the way that we usually do it, but I believe it's going to be just as effective and provide you with just as good information as if you were able to show up in person. I'd like to start out by saying I know that it's a commitment to take the time to sit down and show up and absorb all of this information, and I really appreciate when people keep their promise that they're going to watch this presentation. So I'd like to start out by telling you thank you for keeping your word, and go ahead and give yourself a round of applause because you deserve it. Just want to say thank you for keeping your commitment. Now, I hope I have your permission to be honest with you. I don't like things sugar-coated. I like to tell it like it is, and I think you would probably agree with me. So if I have your permission to be honest with you, and I hope that I do, we're going to go ahead and get started here. All right, the purpose of this talk is to define what is health, where it comes from, how to find it when you need it, and then most importantly, how to get the most benefit from your care, or as I like to put it, how to not undo all of the progress that you make while you're here in our office. We're also going to cover the difference in healthcare models that exist in the world today, how traumas, stresses, toxins, and spinal neglect will eventually lead to poor health, and hopefully provide you with a lot of quality information so that you can make some quality decisions about your health. So to start out, let's talk about the current model of healthcare that most of us are familiar with. Let's just be honest. The United States healthcare system is, bar none, the greatest healthcare system in the world. We have the best doctors, the best education, the most research, the best technology. In essence, we're the top dog when it comes to healthcare. When it comes to trauma, emergency care, life-saving issues, no one is better than we are. Unfortunately, those kinds of issues only represent about 1% of all healthcare. And then on the other 99%, which is chronic conditions of healthcare, the United States ranks about 79th out of 81 countries on the face of the planet. That's not a lot of you probably sports fans. Number 79 out of 81 isn't too good, is it? Part of the problem with that is the allopathic, what most folks think of as doctors and surgeons and hospitals and urgent care and yada, yada, yada. They're based on symptomatology. If you have symptoms, well, then they believe you must have poor health. And thus their objective becomes to relieve those symptoms. So therefore, the present model, health is judged by how you feel. And the problem with that is you can be pain-free or symptom-free and actually be very unhealthy. Think of a cavity. When you get a cavity, you wake up one morning out of bed and all of a sudden your tooth is just killing you, and you go to the dentist and the dentist looks in your mouth and says, yep, that thing's bored itself all the way down to the nerves in your teeth, and that's what's causing you so much pain. How many of you would agree with me that the cavity has been an issue a whole lot longer than just that day? You've been completely pain-free for a while since this thing has been boring itself down into your tooth, wrongfully assuming that the tooth was healthy. It wasn't. You had this hole that was forming, and it just finally took it long enough to get down there where it was actually causing you some issues. But it's been a problem for a whole lot longer than just that day. The 3 leading causes of death: heart disease or heart attack, cancer, stroke. You know what the early symptoms of all of those are? Nothing. There's usually no warning signs that you've got any of this until it shows up on your front doorstep one day, brings you to your knees, and you get rushed off in an ambulance to the hospital. So you can actually be pain-free and be very unhealthy. On the flip side of that, you can have pain and symptoms and actually be very healthy. Take, for instance, if you ingest some tainted food. You go to the buffet down here at the casino and you eat some bad oysters, or the food's been left out a little too long, and you ingest some of that bacteria, your body is going to try and evacuate that food or that harmful bacteria. And let's be honest, it's probably going to be miserable. I didn't say everything was going to be just hunky-dory, but your body is having a healthy response. You wouldn't want that bad food sitting on the inside of you causing more and more and more problems than if you could just get rid of it and fix the situation. Likewise, if you've got a bacterial infection, you have a viral infection, your body is going to raise your body temperature. That raise in body temperature, called a fever, is how the body is going to destroy that harmful bacteria or that virus, and you come out on the other side in a whole lot better condition. And again, I don't know about you, but every time I've had a fever, it is not a pleasant experience, but it is a healthy response. And finally, let's just be really simple with this one. If you touch a hot stove and your brain does not tell you, dummy, get your hand off of the hot stove, it is burning you, well, then something is very wrong. A healthy response is to pull your hand away from that hot surface. Otherwise, you're going to end up with some really injured skin on your hand. And so we've learned that there is not one single definition in any medical research that defines health as being based on symptoms or how a person feels. True health actually becomes this expression of optimal function in our lives. And on this little equation here, you can see that it's multiplied by innate intelligence, or what our internal wisdom is. I call it God's programming on the inside of us. It's the programming that knows how to sew a cut back. When you cut your finger, it knows how to put it back together. It's the same thing that regulates how quickly you should be breathing, or how fast your heart should be beating, or what your blood pressure should be at right then. It's this programming that controls everything, and it requires no conscious thought from us. And if you look at this equation, that innate intelligence is actually a constant. From the day you are born until the day that you die, it remains the same. It's always working. It is always running through its programming. And that function then becomes a variable. So take this guy, for instance. For those of you who don't know, this is Billy Joel. Some of you might not be old enough to really know who Billy Joel is, or maybe you're just not into his style of music, but I'm sure that most of you at some point have heard the song Piano Man. That is Billy Joel's signature song. I mean, Billy Joel could literally sit down at a piano and play this from memory, because he's probably played it thousands of times. I mean, if he sits down at a piano, it's like his fingers automatically want to play it. But what if you went to a concert and, you are sitting on the front row expecting Billy Joel to play Piano Man? This is what you came for. He comes out, sits down to this jacked up piano. It's out of tune. The keys are all messed up. One of the pedals doesn't work anymore. Well, that rendition of Piano Man's probably not going to be exactly what you were expecting. So what Billy Joel represents here is that innate intelligence, that programming on the inside of us. It's automatic. It happens without thinking. So that piano then becomes a representation of our function, or a structure that dictates function. And the music that you hear or experience is the expression of our health. On the flip side, if Billy Joel comes out there and we've given him just this Yamaha baby grand piano, this thing is a precision instrument. It is the best of the best. There's nothing better. Well, if you give Billy Joel that kind of piano, you're going to hear Piano Man like you have never experienced it before. It's going to be beautiful. So to give a quick recap here, we've learned that health is not about symptoms at all. It's all about how function and structure allow that innate intelligence on the inside of us to be expressed. I want to let you know that health is your birthright. You were born with that programming on the inside of you that is programmed to run everything at maximum efficiency. You were designed to be healthy. So the real question then becomes, what limits our body's ability to function properly? And it really comes down to our anatomy. Now, I'm going to keep this pretty simple for y'all. I don't want to take you through 2 years of anatomy and physiology, but let me start off by asking you a question. What organ is the most important organ in all of the body? All right? I'm sure a lot of you have said the heart, and the heart is very, very important. Some of you may have said the skin. The skin is very important. It's actually the largest organ in the body. Maybe that's the information you're pulling from. But the correct answer, and hopefully you said this, is the brain. The brain is the only organ that's completely encased in bone, and it is what controls every process and every cell in the body. That's where all of that internal programming, that innate intelligence is stored, all right? Like I said, your heart knows how to beat, how many times a second. Your lungs know how many times a minute to breathe, to take air in and to push it out. It tells the liver how to do thousands of chemical reactions every single day. You probably know the old expression, you can live 30 days without food, 3 or 4 days without water, 3 to 4 minutes without air, but the second that you take the nervous system and the brain away, you're dead. That's it. Game over. Because if you have no brain, then there is nothing there to control all of those other organs and parts of the body. So then the second most important organ in the body would be the connection point between the brain and the rest of the body, and that's the nervous system. Now today we're going to focus more on the spinal cord, but the nervous system is sort of like the power lines that bring electricity from the power plant to your house. You know, if there's no power lines, you know, like if you're in the middle of a hurricane or something like that, well then you're pretty much going to be sitting in the dark because there's no way to communicate that electricity from the plant to your house. And that's how the nervous system works. It connects the brain and the body together. That spinal cord is also almost completely encased in bone. You know, God in his infinite wisdom knew that we needed to protect these parts of our body, and so he put a protective shell around them. When we're discussing spinal anatomy, we usually break it up into a couple of parts. If you start down at the bottom, you have your pelvis along with the sacrum, or what most folks refer to as the tailbone, that rests in between each side of the pelvis. And that forms the foundation for our spine. And just like the foundation of a house, if your pelvis is unbalanced, then all of the walls built on top of that are going to be unbalanced. So sitting on top of that pelvis and that sacrum is what we call the lumbar spine, the low back. It's made up of 5 different vertebrae, and then on top of that is built the thoracic spine. There's 12 vertebrae in your thoracic spine, and in between those vertebrae are 12 sets of ribs. And unlike your granny probably told you, men have the same number of ribs as ladies do. As far as I know, Adam was the only person who was 1 rib short, and so you have 12 sets of ribs as well. And then on top of that rests the cervical spine, the neck. There's 7 vertebrae there. The very top vertebrae is called the atlas, and it pivots and rotates around a special shaped vertebrae called an axis. And those 2 vertebrae are responsible for probably 80% of the rotation in your neck. So if you're having trouble looking in one direction, let's say, for instance, you're checking both directions for oncoming traffic before you pull out onto the road. If you can't really turn to the passenger side as well as you can to the driver's side, there's probably something going on with those top 2 vertebrae. And then your skull rests on top of that. In between all of these vertebrae, you have what's called a disc. And a disc is kind of like a cushion or a shock absorber. It absorbs the loads of gravity and the stresses that we put on our spine and kind of spread it out a little bit. And it's kind of made like a jelly donut. It's got this hard outer shell with this real soft, squishy, kind of like the insoles in your shoes. It's got this squishy material right in the middle. And what those discs also provide is a space in between the vertebrae for a nerve to exit and branch off of the spinal cord itself. And those nerves are what go out to the body and innervate different organs like your stomach and your intestines and your liver and your kidneys and your lungs and all of that. Small piece of random information here. Like I said, human beings have 7 cervical vertebrae, and if you count really closely on this giraffe, a giraffe also has 7 cervical vertebrae. I think that's pretty cool. I've always wanted to adjust a giraffe, but I haven't yet figured out how to get him into the x-ray room. Take that information. You can use it in your next game of Trivial Pursuit with your friends or Icebreaker at the office. So talking about our incredible nervous system. The nervous system controls every process in the body. We've gone over that. You know, the heart, the lungs, digestion, our body temperature, they're all automatic. The brain controls all of that. The body is also in a constant state of cell replication, and this is how the body heals itself. Like we said earlier, if you cut your finger and As long as you can keep the dirt out of it and the bacteria out of it and keep it from getting infected, well, then the body's going to be able to put that back together. Most of us know that our skin cells are replacing themselves every day. A lot of you ladies know about exfoliation. What are you doing? You're rubbing off dead skin cells, because we know that new ones are going to come right behind it. If new ones weren't coming, it would probably be a bad idea. But the body is creating new skin cells, and it's doing the same thing in all of our tissues. In fact, we get a brand new body every 7 years. I tell smokers this is a really awesome piece of information, because if you can stop smoking today, well, then 7 years from now, it's going to be like your body's got a brand new set of lungs, as though you never smoked a day in your life. And that's pretty doggone cool. So what if there's interference with the nervous system? Well, that's what we would call a subluxation. Now, what a subluxation is a misalignment of one bone on top of another, and when it gets misaligned like that, it gets stuck there. And when it gets stuck there, it begins to place pressure on the nervous system, causing that interference that we were just talking about. There's 5 different characteristics of a subluxation to let us know that it's present. All right, there's going to be pain and tenderness. There's going to be fixation of that joint because it's not moving well anymore. It's stuck there. There's going to be swelling and inflammation around the joint. There's going to be muscle spasms around the joint. And then there's going to be a heat differential from one side of the spine to the other. One side of the spine is going to be hotter or colder than the other. Dr. Chang Su from the University of Colorado, he's probably done more spinal research than anybody alive, said that subluxations are very real. We have documented it to the extent that no one can dispute its existence. I did a paper in college that said there's over 205 different names for a subluxation. If we call it by 200 different names, then it must exist. If we have 200 ways of saying it, well, then it must exist. He also found that the weight of a dime on a spinal nerve will reduce transmission along that nerve by as much as 60%. So more than half of the communication along a nerve, if you just have the weight of a dime on that nerve, pressure caused from one of these misalignments, that's going to interfere by as much as 60%. Half of those messages aren't going to or coming from the brain anymore. So what if those nerves were carrying messages for the heart? What if they were carrying messages for your lungs or your intestines? Or what if in the reverse direction they were carrying messages that were going from the feet to the brain? If your brain can't understand where your feet are in space, that's when you start having balance issues. That's when you start tripping over yourself. The Journal of the American Medical Association said that deviations in the body's center of gravity, you may as well be reading that poor posture. So poor posture has resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip and foot deformities, poor health, decreased quality of life, and a shortened lifespan. So you're telling me that because I look down at my phone all day that I'm not going to live as long? Starting to hit a little close to home, isn't it? And that's not coming from a chiropractor. That's coming from what most would consider to be the Bible of the medical community. So some of y'all are probably wondering, well, what causes these spinal misalignments? What causes these subluxations? And really, we have to go all the way back to the beginning. The first place that you're going to encounter a subluxation is immediately after birth. So during the birthing process, your obstetrician, as the baby is coming through the birth canal, he or she is going to pull on the neck and shoulders in an attempt to maneuver those shoulders through the birth canal. Because if you can get those through there, then the rest of it's pretty much downhill from there. And somewhere along the way, somebody decided to do a study to find out how much force the doctor actually exerts in order to perform this maneuver. And they found that the average obstetrician weighed 170 pounds and the average baby weighed about 7 pounds. And that the doctor exerted an average of 70 to 90 pounds of force to that baby's neck. Now, let me ask you a question. How many of you would hold a baby by their head? None of you, right? They'd call child services on you, lock you away, throw away the key. But you're telling me that you can use 10 times that amount and it be called standard procedure? That's medical practice? It's normal? And parents bring their kids to us and wondering why they have recurrent ear infections and colic and they're constipated. They can't feed from one side versus the other. It all starts here. And then you move on into childhood and it don't get much better. You jump off the swings and land flat on your face and you've got all these falls and tumbles and you're just adding to this cumulative list of stresses placed on your spine. And it doesn't get any better when you become an adult. You slip and fall on the ice, fall down the stairs, you get a soccer ball to the face like this poor guy here. Repetitive motions, that's one of the worst. I know bus drivers who still have those manual doors. They got to open and close them and open and close them. Open once, close it for every single kid that gets on the bus. And over time, that becomes a whole lot of small micro injuries to the same shoulder, performing the same motion over and over and over again, day in and day out throughout the school year. You can also have bumps and jars to the head. You see former President Obama here biffing his head on the helicopter there, and he's probably got a subluxation or two. And then there's car accidents. If you're like this poor person who runs into a tree and totals your car, that's a pretty serious accident. I think most of you would agree with me on that. But the truth is that even low-speed impacts can be dangerous. Studies have shown that you can have harmful transmission of forces through the neck at speeds as low as 4 miles an hour. So that little fender bender that you got into when you were backing your car out of the parking lot and somebody ran into the side of you, you're talking about two vehicles that weigh 2 tons apiece, if not more. That transmission of forces has to find its way out somewhere, and the usual weakest link is our spine. But most of you don't notice it because we have delayed effects from that. You kind of get this little adrenaline burst and you're freaking out about what happened to my car, are all my kids okay? And so you're kind of hyped up on all of these hormones in your body, and you don't really notice that you've got a problem until a couple of days later. Some folks don't realize they're having any trouble for possibly a couple months later. That's why I try to tell anybody, if you're in a car accident, go get checked out immediately. Don't wait. Nip it in the bud. Fix it before it becomes a big problem. I'm not going to spend too much time here, but you know as well as I do, if you ate flaming hot Cheetos every day or McDonald's every day, that's going to place some stress on your system. The old saying goes, you are what you eat. And if you're putting poor fuel into your vehicle, you're going to get poor performance out of it. Likewise, if we put trashy food into our system, we're going to get trashy performance out of our body. Drugs, painkillers, prescription medications, all of these man-made substances come with side effects. And if you take an aspirin for a headache, that aspirin's not just working on your head to make it feel better. It's causing chemical reactions in your kidneys. It's causing it in your liver, in your stomach, in your intestines, in your heart. Everywhere that aspirin is going, it's causing an effect. Likewise, stress. Add stress into here. Johns Hopkins did a study a couple years ago that showed that human beings today are prone to 300 times as much stress as our grandparents' generation was. And it doesn't matter if that stress is coming from your ridiculous hormonal teenager, or your boss gave you a fit today about something, or if a bear is chasing you through the woods, your body is going to respond to that stress in exactly the same way. And so add all that up over 10, 20, 30, 40, 50 years, and you are a hot mess by the time that you get to my office. Folks come in here and they say, Doc, I don't know what I did. I just bent over to pick up a pencil off of the floor, and all of a sudden my back said, nope, you're not going to stand back up again for the rest of the day. I don't know what happened. You had 10 to 20 years of stuff happening to you, and all of a sudden it came to a head, and now you are in terrible shape. But just like that cavity that we talked about at the beginning of our presentation, these problems have been building up over time, and all of a sudden you just woke up one day and it decided to rear its ugly face and make your life miserable. So therefore, the job of a chiropractor and the goal of the chiropractor becomes to restore function to the body. If we can remove these subluxations that have happened over the last year, 5 years, 20 years, If we can remove those subluxations and we can remove interferences to the nervous system, it will allow the brain to run through its proper programming and allow the body to heal itself. Adjustments restore the flow of that nerve communication throughout the body. It allows the body to function how it was designed to operate. An example of this would be if you want to plant a really pretty garden, well, first you got to remove all the trash out of the old garden before you can put new stuff in. Likewise, before the body can heal itself and create good, strong, healthy tissue, you got to get all that trashy scar tissue, that duct tape and band-aids that it put on injuries out of the way to put good, strong stuff back in its place. So 4 frustrations as a healthcare provider and us as a chiropractor. The first one is putting off getting a problem checked. You didn't get that problem checked. You didn't get that leak fixed, and now you've got a bigger problem. And let me tell you, the 5 most dangerous words in the world are, maybe it will go away. And I know that we have all said this or thought this at one point or another. But common sense and reality says that something only goes away when whatever is causing it goes away. And this kind of leads us into the next one. We human beings are great at covering up the problem, especially nowadays when we have direct access to so many things that will dumb down and numb down all of our symptoms. Remember, the allopathic healthcare model is all about symptom management. If we can just decrease the symptoms, then everything will be hunky-dory after that. And that's no better than putting some duct tape on your check engine light. You know, if your check engine light comes on and you just kind of do like that, some of you may have seen the commercial, she just puts a piece of tape over the check engine light there. What's going to happen? Do you think that engine problem is going to get any better, or is it going to get worse? Secondly, is that engine problem going to become more or less expensive to fix? We all know that eventually it's going to blow up. And I don't know about y'all, but I've looked into buying engines because I like to do car restoration and things of that nature. And an engine is not cheap, all right? It would have been just a whole lot cheaper to go get your oil changed or your coolant changed or whatever the heck that check engine light was trying to warn you of. Go ahead and fix the problem while it's a small problem. Third of all, we get frustrated when people miss their appointments. And let me tell you, when Dr. Candy and I come up with a care plan, we honestly try to tailor fit it based on our knowledge, based on our experience. We try to tailor fit it to the individual patient. We try to make it individualized for every single person. It's like coming up with a specific recipe for a cake or cookies or whatever. You know, the recipe calls for 1 cup of flour and half a cup of sugar and 3 eggs, and you bake it for 20 minutes at 350 degrees. I mean, whatever chef came up with that recipe, they tried multiple iterations of that same recipe until they found the exact one that produced the best result. So what would happen if you decided, Nestle Toll House doesn't know how to make chocolate chip cookies? Who needs a cup of flour? I'm going to use 2 cups of flour because twice as much is better. I'm going to use twice as much sugar, but I'm only going to use half the eggs because I only got 1 egg in the fridge right now. But it'll be all fine and dandy, and I don't have 20 minutes to wait for that to get done, so I'm going to crank it up to 450 degrees for 10 minutes. You are not going to get Nestle Toll House cookies out of that recipe because you messed it up. You didn't follow the instructions. You're going to get a Pinterest fail, kind of like this picture says here. It's not going to turn out the way you want it. So just stick with the recipe. Stick with that care plan, and you're going to get the results that you want. And that kind of leads us into the last frustration here, and that's we are just in too big of a hurry as society today. We don't want things today. We want them yesterday. You know, if Amazon Prime does not deliver my package in 2 days like it said it would, suddenly we get all bent out of shape like it's just the end of the world because we've become so accustomed to things being now. Well, nature doesn't work that way. Nature actually has this thing called the 90-day healing principle. What that basically says, it's a law of science. Enough scientists have looked into the healing processes of the body and found out that those inflammatory processes take about 90 days to work from start to finish. And it's the same thing as a woman being pregnant. You can't rush nature. How long does it take for a baby to form in the womb? About 9 months, right? Give or take a week or two or three in my wife's case. It takes about 9 months for that child to form. Now, why does it take 9 months? Well, I don't know either. I'll just be honest with you. I don't know either. Why does it take the body 90 days to heal? I don't know that either. But there's just some laws of nature that we have to abide by, and this is one of them. You just can't rush nature. The Journal of Neurological Science said that the quality of healing is directly proportional to the functional capability of the central nervous system to send and receive nerve messages. That's why a chiropractor does what they do. We want to restore function to the nervous system so that the brain can operate at maximum capacity and heal all of your tissues. All right, so let's recap again kind of how the allopathic healthcare model likes to approach things. Remember, they're a symptom relief model. If they can get rid of your symptoms, well, then you must be healthy once your symptoms are gone. And we learned that that's not exactly true. They treat the body as individual parts rather than a whole. That's why you see folks with heart doctors, ear, nose, and throat doctors, a GI specialist, and a foot doctor. And all they really know what to do is treat the symptoms, and that usually happens by writing a prescription for a medication. And let's talk about pharmaceuticals for a second. There is no drug on the market today that does not have a side effect to it. Every single one has a side effect, whether it's minor, whether it's major, whether it's low risk, high risk, they have side effects. If y'all have ever been in our x-ray room, you've seen our poster in the back that says, I take aspirin for the headache caused by the Claritin I take, for the hay fever I got, from the Zantac, for the uneasy stomach, from the blah, 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 blah. Because my primary problem was high cholesterol, because I don't exercise, I eat flaming hot Cheetos every day, and my spine's all out of whack. Well, if we could just fix the high cholesterol by doing those few simple things, we wouldn't go down this rabbit trail of darkness. We've got to change the way that we do healthcare in this country, because America is 79th out of 81 countries in terms of the how healthy are you as a country index. That's what the total health index is. 79th out of 81. Y'all, nobody wants to pull for that football team, okay? That's almost last place. But we spend $2.5 trillion, that is a T, that's not a typo, $1 trillion on healthcare every single year. I don't think money is fixing the problem. A one-day stay in a hospital is $1,800 to $2,300 a day. That is one beautiful hotel room, okay? A level of spinal surgery, and this is referring to fusion surgery, which, to give you an idea, the allopathic model says, all right, you've got pressure on the nerve, and that's irritating it, so let's take the pressure off, but we're going to bolt those two vertebrae together so that they don't put pressure back on the nerve, right? We're going to fix this permanently. Well, now that those two vertebrae are literally bolted together, they don't move anymore. Well, what do you think that does to the segments above it and below it? Exactly. They got to move extra to make up for the difference. What's going to happen when they have to do extra work? They're going to degenerate and decline quicker than normal. What do you think is going to happen when you go back to the surgeon? He's going to say, oh, yep, same thing's happening. Let's bolt those two together, and down the spiraling staircase we go. Right? And each time that you have one of those surgeries, $75,000 to $115,000 a piece. Steroid injections, $1,000, $1,500 each. They last anywhere from 3 months to a year. And then this one down here, assisted living in the nursing home. If little Miss Jones comes to me and says, Dr. Justin, I'm starting to lose my balance. My kids are scared I'm going to fall and hurt myself in the home. I'm scared I'm going to fall and hurt myself in the home. But I don't want to go to a nursing home. I don't want to go to assisted living. I want to stay in my house. What if I can help little Miss Jones with her balance for a year? What if I could do it for 2 years? Not only have we saved the system or her insurance those funds and how much that costs every year, what have I given Miss Jones? Another year or two of freedom, okay? And that's what this really boils down to, that this slide doesn't show. What kind of time are you losing from your family? What experiences are you missing out on because your back hurts too much to do anything with your kids? And what if we could provide this sort of help to 100 people? What if we could provide this help to 1,000, to 10,000? How could we change this country by getting to the root of the problem and eliminating it? We want to move America up this scale. We need to get as close to the top as possible, and it's only going to happen by changing the way that we do healthcare in this country. Insurance companies, they don't care about your health care either. All they care about is how much it costs their pocketbook, because they're a business, and any business that doesn't make money is not going to last very long. They're a symptom-based model as well. They want doctors to do the least amount they can in the shortest possible time at the cheapest price. Who of you would take your car to a mechanic that does this? You don't want your mechanic to do just the quickest, cheapest work you can, because you know your car is probably going to end right back up in that shop again and again and again. Whereas if you just did the best job possible, fix what needs to be fixed, put good parts back into that car, it's going to run for a long time. That sort of healthcare model is a roll of the dice. And let me tell you, we value two things in this office above all else. Number one is your health, and number two is our reputation for helping people find better health. And a roll of the dice is not in our method of operation. We won't gamble with your health, and we won't gamble with our reputation. We want you to do better, and we have the systems to help you get better. So to recap here, the purpose of chiropractic becomes to remove interference so that the nervous system can communicate with the rest of the body, and that will allow the body to heal itself properly. If we can restore proper function to the body, it can replicate those cells and fix the problems that it has, and that is the true expression of good health. I want to show you a testimonial video here of one of our patients who was dealing with some things in his life that he didn't even realize chiropractic care could help with. And I'm going to go ahead and roll this and let you watch.
So my name is Victor Rodriguez. I'm originally from Fort Stewart, Georgia. My dad's in the military. By way of Lafayette, Louisiana is how we moved over here with my wife and now my son. So I heard about Back in Motion Chiropractic through one of my friends, Dwayne Spell, who's actually a patient here. We were playing softball together in the church league, and I ended up getting injured during one of the games, and he told me to come check out the office. So my injury was one, lack of just me being in physical shape anymore, but it was actually two thigh injuries. So I hit the ball and I started running, and it felt like a sniper got me in both my thighs, and they just stopped working. So he had recommended me to come check out Back in Motion. My perception of chiropractic care, I had some before in Lafayette when we lived there before, and it was a terrible experience. But this doctor, he adjusted every single thing in my body, and I left out of there feeling worse than what I did before I got in there. So far, my experience here has been great. And then just the care and the details that the doctors have. They don't just take what you're giving them and just say, okay, well, let's just do this. Like they actually go into a lot of detail and start figuring out, well, what is the actual cause of your injury. So at that particular time, yes, it was my thighs, and I had hurt it. But there were some underlying things. I was dehydrated, we talked about that. I didn't talk about that, with my last chiropractor that I had before. So it was cool to really see that it's just like they don't take a problem and just look at it and say, oh, okay, well, this is it. There's usually a cause and effect somewhere around there that would cause more things to happen down the road. So one of the things I didn't know that chiropractic care actually helps out is with asthma. I've been a lifelong asthma patient. I've never grown out of it. I've always seen ENTs, I've seen primary care physicians, I've seen the whole spectrum of things, and I'm going on 34 years old. I've never had it under control. So hearing that chiropractic care actually could deal with asthma, it was just like, okay, how? And it wasn't until Dr. Justin had actually adjusted me one time when I was having issues with my asthma and my breathing. It literally felt like I had new lungs. Like it was just like I was driving an old beat up Chevy and now I just got a Cadillac. It's just literally, it was just like an expansion in my lungs, and I felt better. So everything, like all my muscles relaxed, everything was great, and I didn't know chiropractic care could do that. So far, my lifestyle change has been huge. Before, I would think that I was kind of physically in shape, but with my wife wanting to start riding bicycles and stuff like that, and then her getting into chiropractic care also and becoming a patient, it's changed our whole outlook on life. We wake up feeling better in the morning. We go to sleep feeling better at night. But with chiropractic care, everything's so much in line, especially with my breathing now with my asthma. Like, I'm able to bike further. I'm able to run better when I play softball now. I'm able to play basketball again like I used to. Like, before I couldn't, because I would just get that asthma-induced, from playing sports. Now it's just my whole spectrum, so I feel healthier. I got a better attitude. I'm not as grouchy anymore. I'm sleeping better at night. It's changed a whole spectrum of things in my life. From my insomnia has cut back a lot, from working night shifts in the past career that I used to do. I'm able to sleep at night now, and that's huge, especially now that we have a 2-month-old at the house. I need all the sleep that I could get, and with chiropractic care, it's done that for me. So no more of my sleep pills that I have to take at night. I don't have to overinduce myself with asthma medicines, with inhalers 3 or 4 times a day. Everything's been controlled now.
And that, folks, is why we do what we do. We know chiropractic works, and that it works for more things than just neck pain and back pain. We have dedicated our lives to not only helping people through chiropractic, but telling as many people about it as we can. Maybe you personally know a Victor who's dealing with X, Y, and Z, and when you watched that video, you thought to yourself, oh my gosh, Mr. So-and-so needs to be in here. My brother needs to come to chiropractic care. Tell him about it. Get him to watch this video. Maybe you're Victor. Maybe you're dealing with some things that I didn't know chiropractic care could help with that. Tell us about it when you come in. That's things that we need to know about, because we may be able to get out ahead of those conditions and help you with them before they set in and become really, really hard to treat. Because we could get together and talk for 2 hours and about, can you help this? Could you help my Uncle Joe with this? How does chiropractic fix this? Yada, yada, yada. And you know what my true, honest answer for all that is? I don't know. Because the only way we're going to find out if chiropractic can help and be able to solve anything is by getting you or your uncle or your sister or your cousin in here to find out if they have a subluxation that's causing their problem. And if they have a subluxation, a chiropractor is the only place where they're going to get some help. We're the only people who are sitting there trying to find the cause of the problems instead of just treat the symptoms. And if they don't have a subluxation, if it's deeper than that, then we can refer them to the proper place where they're going to get the care that they need. So I'd like to conclude here by saying we've explained how to not undo what we're doing for you here and how to get the most out of your care. And it's by following those recipes, by sticking to your care plan. We've talked about the 90-day healing principle. You got to let the body take the time to do what it's got to do. You can't rush it. You can't rush nature. You were designed to be healthy. It is God's plan for you to be healthy. And if we can remove interferences, your body can take care of that. Because health does not come from a potion or a pill. It comes from the inside out via the nervous system, from the above down and inside out. I'd like to thank you for watching. I hope that you have a wonderful day or a great evening or whatever time of day it is that you're watching this. I want you to be blessed. I want you to be healthy. And we will see you on your next appointment.